You've probably been told that more testing is always better, that catching problems early saves lives, that you should be proactive, get the screening, do the scan, leave no stone unturned. I used to believe that too until I started seeing the same patients return to my office, not with treated disease, but with harm from the tests. Themselves, men and women in their 60s and 70s who went for routine screenings and ended up with unnecessary surgeries, permanent anxiety, invasive procedures that damaged their kidneys, and biopsies that caused infections and bleeding, and every time, when I looked at their charts, the same unnecessary tests kept appearing. My name is Dr. Raymond Cole. I've spent over 20 years treating seniors, and I've learned that after 60, some medical tests cause more harm than good. Today, I'm going to reveal 5 common medical tests that seniors should avoid or at least question because the risk of false positives, overdiagnosis, and dangerous follow-up procedures far outweighs any benefit. This isn't about rejecting medicine. It's about smarter medicine for your age, your body, and your peace of mind. Let me start with a truth that most doctors don't have time to explain and that most patients never hear. A test that is valuable for a 40-year-old can be harmful for a 70-year-old. Why? Because as you age, your body accumulates what we call incidental findings, things that look abnormal on a scan but will never cause you any harm. Let me give you an example. If you do an MRI of the lower spine on a 70-year-old with no back pain, almost 90% will show disc degeneration, bulging discs, or spinal stenosis. But those findings are normal aging, not disease. The problem comes when a doctor sees that MRI report and recommends surgery or injections for a finding that has nothing to do with your symptoms. That's overdiagnosis, finding something that didn't need to be found, and overdiagnosis leads to overtreatment. A landmark study in the Journal of the American Medical Association estimated that 30% of all cancer screening tests in seniors lead to overdiagnosis, meaning the cancer would never have harmed them in their lifetime, but treatment caused serious harm. For example, screening for prostate cancer with PSA testing in men over 75 leads to hundreds of unnecessary prostate biopsies which cause pain, bleeding, infection, and sepsis for every life saved. Similarly, screening mammograms in women over 80 with limited life expectancy often finds slow-growing breast cancers that would never cause symptoms, but the result is surgery, radiation, or hormone therapy that reduces quality of life without extending life. But there's another problem. False positives. A false positive is when a test says you have a disease, but further testing proves you don't. The problem is that getting that false positive result causes enormous anxiety, stress, and often leads to invasive follow-up tests. For example, if you get a false positive on a screening colonoscopy, that's rare, but possible. You might need a repeat colonoscopy or even surgery, but the classic example is the PSA test. Of every 100 men over 70 who get a PSA test, about 15 will have an elevated result. Of those 15, about 10 will undergo a prostate biopsy after further testing. Of those 10 biopsies, about 3 will find cancer. But of those 3 cancers, 1 or 2 are the kind that would never have caused a problem in the man's lifetime. So for every 100 men screened, 1 might benefit from treatment, but 10 underwent an unnecessary biopsy with risks of infection, bleeding, and pain, and 2 underwent unnecessary treatment with risks of incontinence, erectile dysfunction, and bowel problems. That's a terrible trade-off. The United States Preventive Services Task Force, the gold standard independent body that reviews medical evidence, recommends against routine PSA screening in men over 70. Similarly, they recommend against routine mammography in women over 75 with average risk and good health, and they recommend against routine colon cancer screening in anyone over 85. Why? Because at that age, the harms clearly outweigh the benefits. Today, we'll cover 5 specific tests that seniors should avoid or at least question: routine PSA testing after 70, annual mammograms after 75, routine carotid artery ultrasound screening, whole-body CT scans for peace of mind, and routine cardiac stress tests. For asymptomatic patients, let's dive into each one. The first test that seniors should avoid is routine PSA prostate-specific antigen screening for prostate cancer in men over 70 with no symptoms. I need to be very careful here because prostate cancer is real and some men will benefit from early detection, but for men over 70, and especially over 75, the evidence is clear, the harms outweigh the benefits. Here's why. PSA is a protein produced by the prostate, but levels can be elevated for many reasons: benign prostatic hyperplasia, which almost every older man has, prostatitis, inflammation, recent ejaculation, bicriding, or even a digital rectal exam. So an elevated PSA is often a false alarm. But when you get that call from your doctor saying your PSA is high, the anxiety is immediate. Many men then undergo a prostate biopsy procedure where a needle is inserted through the wall of the rectum into the prostate, taking 12 to 18 core samples. The biopsy risks include pain, blood in urine or semen, infection, even urosepsis, a bloodstream infection that can be fatal, the risk of hospitalization for. Infection after prostate biopsy is about 3 to 5% in seniors. Now, if the biopsy finds cancer, what then? Many prostate cancers in older men are low-grade and slow-growing, what doctors call indolent. They will never cause symptoms or death in a man's remaining lifetime. But once you know you have cancer, the pressure to treat is enormous. And treatment, whether surgery, radical prostatectomy, or radiation, carries serious side effects. Urinary incontinence, leaking urine in up to 20% of men, erectile dysfunction in 50 to 70%, and bowel problems from radiation. A major study in the New England Journal of Medicine followed men who were randomized to PSA screening versus no screening. After 13 years, there was no difference in prostate cancer deaths between the two groups, but the screening group had significantly more biopsies, more cancer diagnoses, and more treatment complications. The U.S. Preventive Services Task Force recommends against PSA screening in men over 70. If you're between 55 and 69, it's a personal decision after discussing risks and benefits. But over 70, skip it. If you're a man over 70 with no symptoms, do not ask for a PSA test. And if your doctor orders one automatically, ask, why? What will we do differently if it's elevated at my age? The answer should be, likely nothing, except cause anxiety and potential harm. The second test that seniors should avoid is routine screening mammograms for breast cancer in women over 75 with average risk, no symptoms, and limited life expectancy. Again, let me be clear. For younger women, 50 to 74 mammography saves lives. The evidence is solid, but after 75, the risk-benefit calculation flips. Why? First, breast cancers in older women tend to be slower growing. A 90-year-old woman with a small, slow-growing breast cancer is much more likely to die from heart disease, stroke, or falls than from that cancer. Second, the life expectancy at 75 is about 12 years for a healthy woman, but many women over 75 have other health problems, diabetes, heart failure, COPD, kidney disease that reduce life expectancy to 5 to 10 years. For them, the benefit of finding a cancer that might take 10 years to become symptomatic is zero. But the harms are immediate. A false positive mammogram, which happens in about 10% of screenings, leads to additional imaging, biopsies, and extreme anxiety. A biopsy of the breast is uncomfortable and carries a small risk of bleeding and infection. If cancer is found, treatment may include surgery, radiation, or hormone therapy. In an older woman with frailty or dementia, the stress of treatment can accelerate decline, leading to loss of independence. A large study in the Journal of the National Cancer Institute found that screening mammography in women over 80 led to a 30% increase in breast cancer diagnoses but no reduction in breast cancer deaths. Those women were treated for cancers that would never have harmed them. The American Geriatric Society recommends against routine mammography in women with a life expectancy of less than 10 years, and the USPSTF says there is insufficient evidence to recommend for or against screening after 75, meaning it's a personal decision. But for most women, the harms outweigh the benefits. So what should you do? Have a conversation with your doctor about your life expectancy and your goals. If you're a healthy 75-year-old with a family history of aggressive breast cancer, maybe screening still makes sense. But if you're 80 with heart failure and diabetes, skip it. Focus on managing your blood pressure and staying mobile. Those will extend your life and your quality of life far more than finding a tiny breast spot. The third test that seniors should avoid is routine carotid artery ultrasound screening for people with no symptoms of stroke or transient ischemic ataxia. Carotid ultrasound is a painless test that uses sound waves to look for plaque buildup in the carotid arteries, the two main arteries on either side of your neck that supply blood to your brain. The idea seems logical. Find blockages early, clean them out, prevent a stroke. But here's the problem. Many seniors have some plaque in their carotids. It's a normal part of aging, and the vast majority of those blockages will never cause a stroke. The risk of stroke from a moderate carotid blockage, 50-70 in an asymptomatic person, is only about 1-2 per year, and that risk can be reduced by medications, aspirin and statins, to less than 1% per year. But if you find that blockage on a screening ultrasound, what happens next? Often, the patient is referred to a vascular surgeon, and the surgeon may recommend a carotid endarterectomy, an operation where the neck is opened and the plaque is scraped out, or carotid stenting, a less invasive but still risky procedure. The problem is, for asymptomatic patients, the risks of these procedures are about the same as the risk of stroke. A major trial called CREST found that the risk of death or stroke from carotid stenting in asymptomatic patients is about 3.5. That's higher than the 1% annual risk of stroke with medication alone, so you're more likely to be harmed by the intervention than by the disease. The U.S. Preventive Services Task Force recommends against carotid artery ultrasound screening for asymptomatic adults, yet many health fairs and mobile screening vans offer it for a fee, preying on seniors' fears of stroke. If you have no symptoms, no sudden weakness on one side, no trouble speaking, no vision loss, no dizziness, you do not need a carotid ultrasound. If your primary care doctor orders one because they hear a noise called a bruit, a whooshing sound with their stethoscope, that's also not a reason for screening. Bruits are common in seniors and rarely indicate significant blockage. Only if you have had a TA or minor stroke should you get a carotid ultrasound. Otherwise, say no. The fourth test that seniors should avoid is whole-body CT scans for peace of mind. These are marketed directly to consumers as full-body scans that check for cancer, aneurysms, and other hidden diseases. They cost hundreds or thousands of dollars and are almost never covered by insurance. They sound enticing, wouldn't you? Want to know if something is wrong? But these scans cause far more harm than good. Here's what happens. A whole-body CT scan exposes you to a significant amount of radiation, about the equivalent of 200 chest X-rays. That radiation itself increases your lifetime risk of cancer. But worse, these scans almost always find something. A spot on the lung, a cyst on the kidney, a shadow on the liver, a nodule on the thyroid. Over 90% of these findings are benign, they are normal variants or harmless growths. But once you know they exist, the medical system kicks in. You'll need follow-up tests, more CT scans, MRIs, maybe a biopsy. Each follow-up test has its own risks: radiation, contrast dye that can damage kidneys, infection from biopsy, anxiety, and stress. Many patients end up having unnecessary surgeries, lung biopsies, thyroidectomies, kidney removals for lesions that would never have caused a problem. A large study in the Annals of Internal Medicine found that among healthy people who underwent whole-body CT screening, 40% had an abnormal finding that required follow-up. Of those, 90% were false positives. Only 1% had a finding that was truly life-threatening. So for every 100 people screened, 40 are put through a cascade of anxiety and additional tests, for have a serious false alarm, and 0 to 1 truly benefit. The American College of Radiology says there is no documented evidence that whole-body CT screening is effective in detecting any specific disease early enough to make a difference in patient outcome. So if you see an ad for a $1,000 full-body scan, do not do it. Save your money, save your peace of mind, and save yourself from unnecessary procedures. The fifth test that seniors should avoid is routine cardiac stress testing for asymptomatic individuals. A cardiac stress test, whether on a treadmill or with medication, that simulates exercise, looks for blockages in the coronary arteries. It's a valuable test if you have symptoms, chest pain, shortness of breath, or palpitations. But if you have no symptoms, a routine stress test is not recommended. Why? Because finding a blockage in someone without symptoms often leads to more tests, such as a cardiac catheterization angiogram where a tube is threaded into your coronary arteries. That procedure carries risks: bleeding, infection, kidney damage from contrast dye, and even heart attack or stroke from the procedure itself. And if the angiogram finds a blockage, you might be offered a stent. But what does the evidence say? For people with stable coronary artery disease and no symptoms, stents do not prevent heart attacks or prolong life compared to optimal medical therapy. A landmark study called Orbita found that in patients with stable angina, stents did not improve exercise time or symptoms compared to a placebo procedure. Another trial, Courage, found that adding stents to optimal medical therapy did not reduce the risk of death or heart attack. So you would be undergoing a risky procedure, the angiogram, followed by a risky stent placement for no benefit. The U.S. Preventive Services Task Force recommends against routine cardiac stress testing in asymptomatic adults at low risk of heart disease. Even for those at higher risk, the evidence is weak. What you should do instead: focus on proven primary prevention. Control your blood pressure, treat your cholesterol, exercise, stop smoking, eat a heart-healthy diet. Those interventions save lives. A stress test for no reason does not. Now let me give you my 4-step action plan for avoiding unnecessary medical tests after 60. Step 1. Before any screening test, ask your doctor, what will we do differently if this test is positive? Will it change my treatment in a way that adds years to my life or improves my quality of life? If the answer is vague or will just monitor it, the test is likely unnecessary. Step 2. Know your life expectancy. You can find online calculators, for example, a prognosis that estimate your remaining years based on your health conditions. If you have less than 10 years of life expectancy due to advanced heart failure, COPD, cancer, or frailty, most cancer screening tests will not help you. Step 3. Never pay out of pocket for a screening test offered at a health fair, mall, or mobile van. These tests, carotid ultrasound, whole body CT, PSA, etc., are cash grabs that prey on fear. If a test were truly valuable, your doctor would order it and insurance would cover it. Step 4. Get a second opinion from a geriatrician before agreeing to any major screening or diagnostic test after 75. Geriatricians specialize in the nuances of older adult care and are much more likely to help you. Avoid overtesting. Before I sign off, I must give this important disclaimer. Everything in this video is for educational purposes only and is not a substitute for professional medical advice. Your personal health situation may be different. Some of these tests may be appropriate for certain high-risk individuals. Always discuss any screening decision with your own physician, who knows your complete medical history. Do not refuse recommended tests based solely on this video. I became a doctor to help people live better, not to order more tests. The hardest conversations I've ever had are not about cancer or heart disease. They are about explaining to a patient that the something found on a routine scan is nothing, but the anxiety and the biopsy and the surgery have already taken their toll. You have the power to say no. You have the power to ask, does this test truly help someone my age? Share this video with a parent, a spouse, or a friend over 60, especially someone who gets anxious about health screenings or who goes to every health fair. That share might save them from unnecessary harm. Hit subscribe to Senior Health Hub for more honest, life-saving information. Next week, we're talking about the 3 medical tests that every senior actually should get and why. I'm Dr. Raymond Cole. Stay smart, stay safe, and I'll see you in the next video.